Hello, everybody. Andrew Malkoski with the Denver 100 here, and I am here with my friend Christina Hoffeld with Hoff House Health. And Christina is a health insurance representative. First and foremost, tell us a little bit about exactly what that means.
Oh, okay. So to surmise,
Go for it.
yeah, that means I help individuals, families, small businesses look at their health insurance options. Because I'm doing this day in, day out, I just have a better understanding of what things mean, and therefore I can make it understandable to the everyday person. Similar to you with real estate. There are a lot of terms that people might not know regarding real estate. Well, it's the same with health insurance. And so having that expert kind of in your back pocket to be like, okay, well, this is how we simplify that, makes life a lot easier.
So somebody that just, especially somebody here in Colorado, because you can do business outside of Colorado.
Correct.
But I'm going to use Colorado specifically because that's where we are.
Yeah.
But if somebody was looking for insurance here in Colorado, like they have access to Connect for Health, right? Mm-hmm. And they can shop for their own insurance there. And it is so confusing. Yep. It is literally easier to shop on Zillow for a home than it is to shop for health insurance on Connect for Health. Well, and that's not a slam at Connect for Health.
No. I think people understand real estate though, right? There aren't channels devoted to health insurance. Like HGTV is a thing, right? And so many people have bought and sold homes, or they understand rentals, leases, because we talk about it from when we're tiny. You don't talk about health insurance until you get kicked off your parents' plan, or you get your first big kid job. And then you're just kind of thrown into it. And so I think it is confusing because it's not commonplace conversation, and that's something that I'm trying to change. I think it's not necessarily that health insurance is sexy, because it's not, but it should be something that should be in common conversation.
Absolutely. And so you as a rep, with these things you get to do, what are the most important things that people maybe don't understand about how you can help?
Yeah. So first off, every time somebody enlists help of a professional, they assume there's cost associated to them, right? And as money just gets tighter and tighter for people become more adverse into enlisting people's help. And so one of the things that I like to tell people, because it's true, I get paid by the carrier. I don't get paid by you. Mm-hmm. So it costs you nothing to work with me other than time and wanting to dive a little deeper and understand your options. So that's like a huge misconception, is that, oh, I'm going to hire a broker or a representative or advisor, and now I'm coming out of pocket, I'm responsible for their fee, their commission, whatever it is. And that's just not the case. So,
well, and one of the other things that I learned from you literally the last time we got to hang out was that your services don't stop at just, hey, I helped you find and purchase the insurance. Yeah. You have an entire side of you that is advocacy.
Yeah. So I wake up and choose violence every single day of my life.
I love it.
I enjoy arguing, and that is part of my services, right? So not only am I going to get you health insurance, but I want our relationship to continue after your plan is in place. If you have claims questions, call me. I will happily walk you through that. If you are getting the runaround from the insurance company, call me. I will help you. There's a completely separate broker line that customers don't have access to.
That's incredible. And I had no idea that until you had told me that the other day.
And so that way we can just be more efficient to make sure that everything's done properly. I will tell you, more often than not, the mishaps have to do with coding issues between the practice or the hospital and the insurance. There's whole departments where they're just entering numbers in when you go, and sometimes numbers are misentered. And so it helps having somebody who understands the field to say,
absolutely,
hey, was this coded properly? This is what they said had done. Let's check with the doctor even if we need to. I've called practices as well. I've called practices to see if people are in network, because sometimes it'll be listed on their website, the practice's website, that somebody isn't in network, but it takes 30 seconds for me to call and find out if that's true or not, because sometimes they don't always list that. And so again, you're getting an advocate, as you mentioned. You're getting somebody, a teammate, somebody on your side, somebody who can be with you through the lifetime of your policy.
And if you've never had to call your insurance company and try to figure out something when you don't know even how to ask the question correctly, like, man, that just seems like a wildly valuable service.
I agree. Well, I'm dating myself now because I grew up in the era where you could slam the phone down, right? and the other person, like, it hurt their ears, and that's sometimes what it feels like. You want to be able to do that because you feel like you're just talking in circles, or you've got to get through the bots, which is super annoying. And then you're screaming on the phone, representative, I didn't hear that. Oh, you did hear it. You're not programmed to,
That's why you need to have Christina as your representative. So.
Correct. Because I can actually talk to humans, which is kind of nice. So
Well, thank you so much for coming and joining us today. Tune back in for the next episode. We're going to talk a little bit more with Christina here. Thank you so much for being here.
Thanks for having me, Andrew.
Absolutely.